Hi, my name is Linda Van Scoter. I'm the Respiratory Therapy Program Director. And I think respiratory therapy is a great profession to get into because you can do so many things as a respiratory therapist. You can take care of little tiny babies, adults, elderly people. You can work in critical care. You can do home care, rehabilitation, all of that sort of thing. And our program here at IUPUI is a baccalaureate degree program. It's a 4-year degree, which is the only one in the state. All the other respiratory programs in the state are associate degrees. And we're a little unusual, too, in that we're a consortium, which means we bring in students from IUPUI, Ball State, and University of Indianapolis to the program. So if you're one of our students, you might be sitting next to, say, a Ball State student or that sort of thing.
I chose respiratory therapy because I'd worked in the manufacturing industry for a while and I wanted something more challenging and more meaningful. My fiance is a respiratory therapist and she opened me up to it, and I shadowed and I really enjoyed it and saw what all there is out there that respiratory therapists can do.
Well, respiratory therapy wasn't my initial choice, but I'm really happy that I fell into it. I guess my thing is I've just decided to stay in school and stick with it, and I chose respiratory therapy because my mom's one. I've had a great life, and you know, it was rewarding to her, and I've always wanted to do something in the medical field.
I have my degree in finance and marketing, but I didn't want to stick with finance. I wasn't too much into business as much, but I still went ahead because I had a little bit of interest, but then in my back of my head I still wanted to do medical. So I looked into respiratory, and it fit well. The classes that I took for finance, some of them did transfer, so it worked out well for me.
We also have a setup where you do 2 years of prerequisite courses and then 2 years of professional coursework. And even though you remain enrolled at your home university, you actually take classes and labs at Methodist Hospital in Indianapolis. And then we also send you out to clinical sites all around the state as well, so that's a little unusual. Most of our clinical sites are right around Indianapolis, but we can go as far north as Muncie or as far south as Bloomington for clinic.
I've had many clinical days that I loved. Probably my last clinical day was the best. There was a code in the morning where we brought this lady back to life, me and another student, so that was really cool, really rewarding.
In class you're sitting there, oh, why am I learning this? But when you go out in the real world and notice, oh my God, this person has this disease, and you know the symptoms and the medicine and all that, how it's going to work for the patient, it's really good feeling.
As far as patient interaction goes, I really enjoy that because you come in and see the patient at the beginning of the day, and you can see how they change throughout the day and how you can impact their day in general. If they're having trouble, you can help them out, and just do little things for them to see what little bit you do, how much it does impact their hospital stay.